Well, one of the biggest names in the music industry is continuing his involvement with raising funds for breast cancer research. Legendary guitar maker Paul Reed Smith hosted the 16th annual One Night, One Show, One Cause benefit concert at the Johns Hopkins Kimmel Cancer Center. Paul Rodgers, lead singer for the band Big Bad Company, was headlining that act. And Smith is also working on new research that would lower the radiation levels during mammograms with the use of sound waves. How about that? 11 News reporter Sarah Caldwell will have much more on that story a little later this year. And starting in January, Sarah will put together a feature on the 11th of every month focused on breast cancer, from early detection to reconstructive surgery, even tattoos and tattoo removal. That starts on November the 11th. Now, when it comes to treatment, the Montefiore Medical Center in New York is leading the way to forego chemotherapy. A recent study out of that medical center suggests that women in the early stages of breast cancer may not benefit from chemo. Instead, genetic testing shows that those women were likely to respond better to hormone-blocking drugs. The doctor behind that study explained it all to us a little earlier this week in depth.
So what this test does, it provides us with more accurate information about what the risk of recurrence is over the ensuing 5 to 10 years after a cancer diagnosis. And hence what the likelihood of benefit from chemo is. So in other words, if this test can tell you that you have only a 1% chance of having recurrence over the next 5 years with just local therapy, that is surgery and hormone therapy, endocrine therapy, pills taken for 5 years, that tells us that chemotherapy is not likely to be a benefit. So it could help patients who are considering chemotherapy and their doctors who are making recommendations for chemotherapy make a much more informed decision about what will be the best therapy for that individual patient.
Knowing the toll that chemo can have on a person, being able to take this step out, I'm guessing it could be a big change for someone's outlook, at least physically and emotionally, knowing that that's not something they have to go through.
Absolutely. I mean, we can give chemotherapy very safely to most patients. We get them through it, but it's not something that if it's something that we can avoid, we certainly should avoid it.
Before this test was around, for someone even in the early stages, what would they face? Was chemotherapy a certainty?
Not necessarily a certainty. It's a decision that's made, based on a discussion between the patient and the physician. Each individual would have to assess what their risk of recurrence is, what the benefits of chemo would be, what the side effects of chemotherapy would be, and make a decision about whether or not the potential benefits were worth the risks. Here, patients can make a much more informed decision in that case, because they would now know if they had a low-risk score by this test that it would be extremely unlikely that they would benefit from chemotherapy.
I'm sure that some folks here, as they see this program, will wonder about accessibility, being able to get their hands on something like this with their doctor. Do you think it's something that your average patient will be able to reach out and be part of? And with doctors, are they seeing it right now as something that they'll put into their tool chest as something they can use currently?
Yeah, absolutely. This test has been around for about a decade. It's been ordered in about 500,000 women since it first became commercially available. But what we now know, the new information that we have, is that we can make treatment recommendations with much greater confidence based on this test result.